Doctor, you're an expert on cancer. Can you talk about why the conventional treatments don't work any better than they should? The chemotherapy, the radiation, the surgeries. Why are their success rates as low as they are?
They cannot work. Dr. Tutu Simoncini, oncologist himself in Rome, Italy, stated that the medical profession has a cancer cure rate of 2%. In my experience and a lot of colleagues, 27% of all people that have cancer and do nothing get cured. They don't know why, but they get cured. So that means the medical profession statistically even kills the 25% that would have had survived. Two independent studies show I have a cancer cure rate of 92.3%. So if you look at the facts, if you look at it, I cured my own mother from hepatitis C, liver cirrhosis, and liver cancer 42 years ago. And she's still alive today, 76 years old, perfectly healthy, 100% liver. If you just look at these facts and you look at the background of the medical profession, John D. Rockefeller, the one that made the big money originally, he created the curriculum for the entire medical education in the world. And he made sure that only the chemicals he produced are used for the treatment of illness, no matter what it is. We are still working under the same premise today. That's why no medical doctor ever learns about curing anything. They learn about chemical intervention or surgery to suppress symptoms. They don't go for the root cause. They don't look for the root cause. They have never learned about curing anything. And they are a pseudoscience. Basically, the medical profession is a religion. Just ask them something and then to prove it, or then they say, I believe, or in our experience, or our tests have shown, or something like this. People believe the medical profession is a science because they use scientific tools. That's their trick. See, you look at you take blood, and you do kind of like a level on something. You check the liver, and you have all these numbers there. Looks really scientific, doesn't it? But what do these numbers tell you? Absolutely nothing. I have seen people dying of liver cancer with all their liver levels were 100% okay. On the other hand, there's nothing they can do. They have no solutions. So when you radiate somebody, it's causing scars. A scar can never return or turn back into healthy tissue. It's impossible. You can never create a healthy cell again from a scar tissue. That's why we have the problems with burn victims, of course. That's how they look in the inside, like a burn victim. Look at somebody that gets their face burned. How they look on the outside. That's how you look in the inside after radiation therapy. It's an assault with a deadly weapon. Chemotherapy, we talked about it, is based on mustard gas. Mustard gas is like the Agent Orange of the medical profession. And it goes, their premise is, the idea behind all of this is, if you have a garden with flowers and bushes and trees and grass and some weeds, you come with Agent Orange and you kill it all off. And now it's all dead. And now you hope only the good stuff comes back, the flowers and the trees and the bushes. And the weeds will not. What's usually coming back, and it's only the only thing that's coming back are the weeds. And the same is with cancer. They bombard the entire system, and then they say the cancer is in remission. Listen to that lie. The cancer is in remission. So, okay, you killed every body function. You killed the metabolism. You killed basically every bioelectrical, biochemical function in the body that you can kill without killing the person. Very often, of course, they kill the person. And now, for 3 years, nothing works, good or bad. And they say, see, the cancer didn't grow anymore. And of course, the cancer tumor shrunk. Of course, if you bombard it with poison, if you radiate it, if you poison it with chemotherapy, of course it shrinks because you dehydrate it. You turn it into scar tissue. And since nothing works anymore for 3 years, you have no cancer, you're cured. You're just dead in 5 years, but otherwise you're cured. And when you look at the facts, they have in their statistics, somebody is cured that is still alive 5 years after the first day of diagnosis. If you start the very first day to die, the very first day after diagnosis, you go to chemo, to radiation, you're in bed, you're in hospice, you're just dying. And you die 2 days later after the 5 years are over, you are in their statistics as cured. So I kind of like have a slight problem with that. Now they make it even shorter. They say, no, we turn it down to 4 years. If you're 4 years after first diagnosis, you are still alive, you're cured. So now a miracle happened. Their cancer cure rate went up like crazy. Because now they have to just keep them alive for 4 years to have them as cured in the statistics. And why is statistically the suicide rate of doctors, MDs, the highest? Why is the alcohol and drug abuse rate statistically the highest with medical doctors? Why has a doctor statistically the shortest lifespan of all professions of 56 years of age? Very simple. These poor guys figure out over time that they have no tools and that they are murdering and murdered their patients. Because every doctor is a good person when they start out. You do not go into the medical profession saying, oh, I just want to kill some people today. No, you're a good heart, you're a good person. And you go into the medical profession, in the first year, in the first 2 years, you're really excited, and you're really in it, and you're giving it all, until you find out no matter what you do, the patient gets worse, or they cure themselves. You just need to bridge them for a while. Like they say, a treated cold takes 2 weeks, and untreated 14 days. So, you know, and then these poor doctors figure out that they cannot help. And all of a sudden they figure out that all these people are dying, no matter what they do. Look at Patrick Swayze, what they did to this poor guy, and how he looked the last pictures. And he could have been cured in a couple of days. And it is just all a really sad, sad thing. But obviously enough people have to die first until people get really fed up and start standing up for themselves. And at the Health Freedom Expo here, Paul Andrews and Julie Klein, they put all their money in it, all their time. Everything they think and live is make this wonderful event going. And that's why all the speakers are coming here. Nobody gets paid. Everybody pays their own expenses. Nobody gets paid. We don't care. We invest. I'm booked 3 years ahead every single weekend. I break one appointment and cut it off to come here to help out because of these wonderful people and all the great speakers here and all the colleagues here. We are making a difference. A couple of years ago, that was a tiny, tiny club. Today, it's a very powerful organization.